My name is Judd and I'm a clinical matron for health and wellbeing, which is a long-winded title. Basically means I work in primary care, but I have a project that works across secondary care into mental health, looking at the physical health needs of patients with long and enduring mental illness. I think nursing gives you the opportunity to go wherever you want really, and when I first qualified I worked in elderly health, which was a useful grounding to sort of solidify those skills that you learn as a student. And then having watched episodes of Casualty, I decided that's where I was going to go. So I worked there and that was fantastic, really good experience. And you have to make decisions on the spot, but great to work in a great big team like that, and the camaraderie was fantastic there. I was then given a promotion within the department and went to work in surgery, acute surgery, and your feet didn't touch the ground from the minute you walked in the door to the minute you went home. And then obviously your social life takes over, and I met my husband and married and started a family, and it made it difficult to work full time. So I went for a job in the community nursing and was fortunate enough to get into a general practice, and I was very much part-time, and as my children have grown I've increased my hours and gone up to full-time hours again now. The work in the GP practice is a lot around educating patients. That's what then made my decision to actually think about taking on more of a role of teaching nurses. So that brings you up to date where I am now. I moved back into the acute sector or into the community hospital sector. Looking at the structure of the skin, that's really important when you establish the sort of injection you're going to be giving. Now with an intramuscular injection, which is the way we will be giving our flu injections, I love the teaching because it's really inspiring to think that the next generation of nurses that are coming through are getting the experience that they need by somebody who's already been nursing for 25 years nearly now. I like to think that I do my job to my best of my ability, and I like to be able to show that and demonstrate that.